When seeking mental health support, the biggest question now is in person or online? We assume in person is best, but what if for social anxiety or ADHD, virtual therapy is actually more effective? And that vital therapist connection, research shows that bond can be just as strong through a screen. This is about more than outcomes. It's about access, consistency, and removing real-world barriers to care. We'll show you virtual care's strengths, its weaknesses, and give you a framework to find your perfect fit. First, the baseline question, is virtual therapy effective? For depression and anxiety, studies show it is just as effective as in-person sessions. The first obvious win for virtual is logistics. No commute, no gas money, no arranging childcare. This expands access for people in rural areas or with mobility issues. Quality care is no longer limited by your zip code. And since geography is irrelevant, you can find a therapist who specializes in your exact needs, not just who is nearby. But if you aren't in the same room, how does it still work? What is the core component that makes therapy successful? The answer is something clinicians call the therapeutic alliance. It's the trust and rapport between you and your therapist, and it's the biggest predictor of success. This alliance is built on empathy and shared goals, not physical presence. Studies confirm patients feel just as connected and satisfied with virtual therapists. This holds particularly true for talk-based methods like CBT. These structured conversations translate perfectly to a video call format. Now, back to our hook. Why can it be more effective? For social anxiety, avoiding a waiting room removes a massive barrier to even starting. For OCD, therapy can happen in the home where triggers exist, making treatment more direct and impactful in the moment. However, a key variable is the therapist's own comfort and skill with the technology. An experienced telehealth provider knows how to build rapport on screen, so we know it can be effective in theory. But what does that look like in the real world? Let's examine the practical impact. One of the most surprising statistics is the sharp drop in no-show rates for appointments. When attending is as simple as clicking a link, patients are far more likely to be consistent with their treatment plan. This consistency makes a huge difference. Regular attendance is fundamental to making real, lasting progress in therapy. Imagine a new parent finding an hour or a professional fitting a session between meetings. Virtual care makes therapy possible for them. Or consider a person with agoraphobia who cannot leave their home. Virtual therapy is the only option to start. With all these benefits, it might sound like an easy choice, but virtual therapy has significant drawbacks we have to address. The most obvious is technology. A bad connection or frozen screen can shatter a personal moment. The digital divide can also exclude some people. For therapists, the challenge is a limited view. A camera only shows so much. They can miss subtle cues, a tapping foot or clenched fists. For the patient, finding a truly private space can be difficult. Worries about being overheard can prevent you from opening up fully. And most critically, there are safety limits. For acute crises or severe suicidal ideation, in-person care is non-negotiable for immediate intervention. So it's not a case of virtual is good or in-person is bad. The real question is about matching the method to the person. Let's connect two ideas. While patients report a strong alliance virtually, some therapists perceive it as weaker because they miss that nonverbal data. Given that both have unique strengths and weaknesses, are you forced to choose just one path? Not anymore. The future of mental health care is increasingly about hybrid models, combining the best of both worlds for your specific needs. For instance, you might start with in-person sessions to build strong rapport, then switch to virtual for convenience and maintenance. This brings us to the main conclusion. The decision between virtual, in-person, or hybrid care should be a collaborative conversation with your provider. To prepare for that talk, ask yourself, how severe are my symptoms? Do I have a private space and good tech? How big a factor is convenience for me? The key takeaway is this: virtual therapy is not a second-best option. It is a powerful, effective, and sometimes superior tool in the mental health care toolkit. So that initial idea that for some, therapy through a screen is better isn't just a hook. It's a reality driven by circumstance, convenience, and clinical need. The best method is the one you will consistently use. Don't let the how stop you from getting help. Discuss your options and take the first step.